Welcome, my name's Russell Dovison from Bayside Podiatry. Today I'll be discussing gait plate or lateral gait plate additions to your orthotics. Often there are levels and degrees of extension you can use on your gait plate. Now the standard gait plate extension will take the lateral anterior edge of the orthotic to basically the base of the fifth toe. Now, there's been many a time when there's been a mild case of just in-toe gait where I might use half that length. There's also been opportunity on discussion with Arthur when there's been gross in-toeing. As long as footwear is appropriate, you can actually extend that further and take that beyond the small toe, possibly 4, 5, even 6 millimeters. My rule of thumb has always been anything that's 10 degrees of in-toe or less, you can utilize your half gait plate extension. Anything over that is when you start using either the standard length or beyond maybe 20, 25 degrees of in-toe, you can extend it further. You must be careful with metaductus if you even slightly invert the forefoot whilst utilizing a gait plate, you will often have no result. You might even actually have an increase in the amount of in-toe. And that's basically because you're laterally weight-bearing and almost exaggerating the contracture, which causes the metaductus. Obviously, there can be osseous and soft tissue metaductus, but you tend to exaggerate that posture if you are, for example, utilizing a joey with a modified root addition, forefoot addition, and then having your gait plate. You actually might make the child's condition worse. So my suggestion, you can still use a gait plate, but you use a flat plate. So it's not actually cupped orthotic. It is a flat piece of polypropylene with a gait plate extension going up to the base of the left of the fifth toe. This still allows for the take-off intervention of a gait plate without actually providing the inversion through the forefoot or even rear foot, but mainly through the forefoot, that an orthotic can sometimes provide with a metaductus foot type, and in turn exaggerating that in-toe position. As far as scripting goes, is draw where I want my gait plate extension to finish. And that's the great flexibility of what footwork provides. They will follow your order exactly, even to the point of laterally extending out the gait plate. So rather it just going straight up to the small toe, if there is enough room in the shoe, you can actually laterally extend that point. So it's going away from the small toe. Opposite to that can be if the shoe is slightly tapered and you're concerned about fit, you can actually round and medially tape the gait plate extension. My suggestion there is draw where you want your gait plate to extend to. If using casted orthotics, same thing applies. I'll often, on the cast itself or on a piece of paper again, draw to the laboratory exactly where I want that extension to go to. I suppose my main message here is be selective with your extension. Utilize your half length for mild cases. Utilize your full length or standard length for moderate cases, and for your severe cases, extend it. And finally, with scripting orthotics where I want to utilize gait plate extension and reduce in-toe, I will often start with an orthotic that has no rear foot posting or no rear foot heel stabilizer. Again, my mechanical concerns of the foot at this stage are not about posture of the foot, they're about position of the foot. So often what a posting through the rear foot or a stabilizing of the rear foot, it will cause a lateral momentum through that rear foot, and sometimes you'll see the child almost over-invert as they're walking, and that will exaggerate that sort of in-toe posture. Hopefully, some of these things are helpful.